Drug addiction, also called substance use disorder, is a disease that affects a person's brain and behavior and leads to an inability to control the use of a legal or illegal drug or medicine. Substances such as alcohol, marijuana and nicotine also are considered drugs. When you're addicted, you may continue using the drug despite the harm it causes. Drug addiction can start with experimental use of a recreational drug in social situations, and, for some people, the drug use becomes more frequent. For others, particularly with opioids, drug addiction begins when they take prescribed medicines or receive them from others who have prescriptions. The risk of addiction and how fast you become addicted varies by drug. Some drugs, such as opioid painkillers, have a higher risk and cause addiction more quickly than others. As time passes, you may need larger doses of the drug to get high. Soon you may need the drug just to feel good. As your drug use increases, you may find that it's increasingly difficult to go without the drug. Attempts to stop drug use may cause intense cravings and make you feel physically ill. These are called withdrawal symptoms. Drug addiction symptoms or behaviors include, among others, feeling that you have to use the drug regularly, daily or even several times a day. Having intense urges for the drug that block out any other thoughts. Over time, needing more of the drug to get the same effect. Taking larger amounts of the drug over a longer period of time than you intended. Making certain that you maintain a supply of the drug. Spending money on the drug, even though you can't afford it. Not meeting obligations and work responsibilities, or cutting back on social or recreational activities because of drug use. Continuing to use the drug, even though you know it's causing problems in your life or causing you physical or psychological harm. Doing things to get the drug that you normally wouldn't do, such as stealing. Driving or doing other risky activities when you're under the influence of the drug. Spending a good deal of time getting the drug, using the drug or recovering from the effects of the drug. Failing in your attempts to stop using the drug. Experiencing withdrawal symptoms when you attempt to stop taking the drug. Sometimes it's difficult to distinguish normal teenage moodiness or anxiety from signs of drug use. Possible signs that your teenager or other family member is using drugs include problems at school or work, frequently missing school or work, a sudden disinterest in school activities or work, or a drop in grades or work performance. Physical health issues, lack of energy and motivation, weight loss or gain, or red eyes. Neglected appearance, lack of interest in clothing, grooming or looks. Changes in behavior, major efforts to bar family members from entering the teenager's room or being secretive about going out with friends, or drastic changes in behavior and in relationships with family and friends. Money issues, sudden requests for money without a reasonable explanation, or your discovery that money is missing or has been stolen or that items have disappeared from your home, indicating maybe they're being sold to support drug use. Diagnosing drug addiction, substance use disorder, requires a thorough evaluation and often includes an assessment by a psychiatrist, a psychologist, or a licensed alcohol and drug counselor. Blood, urine or other lab tests are used to assess drug use, but they're not a diagnostic test for addiction. However, these tests may be used for monitoring treatment and recovery. For diagnosis of a substance use disorder, most mental health professionals use criteria in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, published by the American Psychiatric Association. Although there's no cure for drug addiction, treatment options can help you overcome an addiction and stay drug-free. Your treatment depends on the drug used and any related medical or mental health disorders you may have. Long-term follow-up is important to prevent relapse. Treatment programs. Treatment programs for substance use disorder usually offer individual, group or family therapy sessions. A focus on understanding the nature of addiction, becoming drug-free and preventing relapse. Levels of care and settings that vary depending on your needs, such as outpatient, residential and inpatient programs. Withdrawal therapy. The goal of detoxification, also called detox or withdrawal therapy, is to enable you to stop taking the addicting drug as quickly and safely as possible. For some people, it may be safe to undergo withdrawal therapy on an outpatient basis. Others may need admission to a hospital or a residential treatment center. Withdrawal from different categories of drugs, such as depressants, stimulants or opioids, produces different side effects and requires different approaches. Detox may involve gradually reducing the dose of the drug or temporarily substituting other substances, such as methadone, buprenorphine, or a combination of buprenorphine and naloxone. Opioid overdose. In an opioid overdose, a medicine called naloxone can be given by emergency responders, or in some states, by anyone who witnesses an overdose. Naloxone temporarily reverses the effects of opioid drugs. While naloxone has been on the market for years, a nasal spray, Narcan, Kloxxado, and an injectable form are now available, though they can be very expensive. Whatever the method of delivery, seek immediate medical care after using naloxone. Medicine as part of treatment. After discussion with you, your healthcare provider may recommend medicine as part of your treatment for opioid addiction. Medicines don't cure your opioid addiction, but they can help in your recovery. These medicines can reduce your craving for opioids and may help you avoid relapse. Medicine treatment options for opioid addiction may include buprenorphine, methadone, naltrexone, and a combination of buprenorphine and naloxone. Behavior therapy. As part of a drug treatment program, behavior therapy, a form of psychotherapy, can be done by a psychologist or psychiatrist, or you may receive counseling from a licensed alcohol and drug counselor. Therapy and counseling may be done with an individual, a family, or a group. The therapist or counselor can help you develop ways to cope with your drug cravings, suggest strategies to avoid drugs and prevent relapse, offer suggestions on how to deal with a relapse if it occurs, talk about issues regarding your job, legal problems, in relationships with family and friends, include family members to help them develop better communication skills and be supportive, address other mental health conditions. Self-help groups. Many, though not all, self-help support groups use the 12-step model first developed by Alcoholics Anonymous. Self-help support groups, such as Narcotics Anonymous, help people who are addicted to drugs. The self-help support group message is that addiction is an ongoing disorder with the danger of relapse. Self-help support groups can decrease the sense of shame and isolation that can lead to relapse. Your therapist or licensed counselor can help you locate a self-help support group. You may also find support groups in your community or on the internet. If you like our work, so please subscribe our channel and like the video and share.